Interesting article here from Healthline. People living in these 10 states more likely to die before age 75. So check to see what state you're living in. And if you're not 75 years old, you might want to leave. A new report has ranked the states with the highest and lowest rates of premature deaths occurring before age 75. Right? A new report discovered the top 10 states that had the most premature deaths occurring before age 75 in 2020. Mississippi topped the list with 13,781 premature deaths. Unintentional injury, cancer, heart disease, and COVID-19 were the top reasons for premature deaths. One of the constant mysteries of life is knowing exactly how many years you will live. However, you can gain some understanding based on the fact that the average life expectancy in the United States is 76 years old, according to the Centers for Disease Control and Prevention. Passing away before then is considered a premature death, and the state you live in might indicate your odds of falling into that category. A report by NY, I guess that's New York requirements, analyzed the states that were most impacted by premature deaths in 2020 based on the years of potential life loss before age 75 per 100,000 people. The report found the following to be the states with the highest rates of premature deaths. That's Mississippi coming in at number 1. All right. West Virginia, number 2. Louisiana, number 3. Alabama, number 4. Kentucky, number 5. New Mexico, number 6. Tennessee, number 7. Arkansas, number 8. South Carolina, number 9. Oklahoma, number 10. The only state in there that's not a red state is New Mexico. All the others are red state. Mississippi, West Virginia, Louisiana, Alabama, Kentucky, Tennessee, Arkansas, South Carolina, Oklahoma. Interestingly, Texas is not there. Yeah, maybe because they eat all that cattle down in Texas. Reason for premature death in 2020, according to the National Center for Health Statistics Years of Potential Life Loss report. The following were the reasons for premature death in 2020 in this order. Unintentional injury. 2. Cancer. 3. Heart disease. 4. COVID-19. 5. Suicide. 6. Homicide. 7. Liver disease. 2020 was an unprecedented year for lives impacted and lost due to COVID-19 and COVID-19 related disease, with healthcare workers and resources maxed out and consumers being hesitant to go to the doctor or hospital. There were additional delays in treating individuals with chronic illnesses. Dr. Carmel Person, a geriatric physician at Northern Community Medical Associates, told Healthline. Many people were isolated from family, friends, co-workers, with some feeling hopeless. They turned to unhealthy coping mechanisms, including excessive alcohol use, tobacco use, sedentary lifestyle, and overeating, she added. The consequences of the pandemic led to a delay in care for Americans with acute traumatic injuries and complications related to chronic diseases, added Dr. Robert Glatter, ER doctor at Lenox Hills Hospitals in New York. Mental health care was a prime example where our healthcare system were unable to accommodate those who were suicidal and depressed, leading to a spike in suicides, along with a dramatic increase in homicides due to gun violence, he told Headline. Alcohol use sharply increased, further complicating care in our hospital systems for those with alcohol poisoning or withdrawal. And they go on to mention the populations at risk for premature death. The report found that populations at greater risk for premature death include Alaska Native American Indian people, who have premature death rates around 50% higher than those of non-Hispanic whites. Additionally, infant mortality rates were almost twice as high among this population than they are among white children. The rate of premature death among black population was consistently double that of the white population from 1960 to 2009. With cardiovascular disease, homicide, and infant mortality being the driving factors. Moreover, black populations have the highest infant mortality rate in the United States. Right? That's like living in a developed country, a third world country, that black populations have the highest mortality rate. It's like, what the hell is going on? People in rural communities are also at higher risk for premature death. White adults in rural areas have a steadily rising early mortality rate, largely due to poisonings, drug overdoses, and suicides. Ethnic and racial disparities, economic inequality, along with geographical influences, all play a clear role in elevating overall risk for premature death. Addressing such health, economic, and geographic disparities is crucial to not only improving and buttressing public health infrastructure, but also addressing future pandemic response, said Glatter. He added that loneliness and depression in older Americans living alone with few social ties is another population that is affected by spiking rates of depression, anxiety, and suicide. States where you are most likely to live longer and how to live longer. Hawaii, Massachusetts, Minnesota, New Hampshire, and Washington. Not Washington, D.C., but Washington and the West Coast. Washington State, there, right below Vancouver. Yeah, that's what they're talking about. That Washington. So that's in the article here, and I'm going to put a link. And they show steps you can take to lengthen your lifestyle. Limit alcohol intake, prioritize nutrition, avoid risky behavior. We know where they're going with that, right? Riding the motorcycle, rock climbing, teach children preventative measures, know your family medical history, seek medical oversight, stay socially engaged. Well, I think that's interesting to know that the states where you live longer will be Hawaii. Isn't that something?